Meningococcus is a severe bacterial infection caused by the bacteria Neisseria meningitidis. Now, it's spread through respiratory droplets, and in most of us, it can just live there on the nasal mucosal surfaces and then leave and not cause any problems. But every once in a while, it gets into our bloodstream, and that's where it causes havoc, where it can lead to serious bacterial infections in the blood, bacterial meningitis, even pneumonias and ear infections. For the most part, meningococcus is just a sporadic occurring disease where people get it, and sometimes it causes problems. But occasionally it can happen in outbreaks. Those outbreaks usually happen in close living situations, such as happen on college campuses, military barracks, or camps. Meningococcus is a bacterial infection that's contagious and typically has an incubation period of about 2 to 10 days. What that means is from the time you're exposed until you're sick. Now, the most common presentation is bacterial meningitis. It usually presents with really high fever, headache, nausea, vomiting, and a stiff neck. This usually causes them to go to the emergency room very quickly because they're very sick, but even with proper medical treatment, it still has a mortality rate of about 9 to 12%. The next most common presentation is what's called bacteremia, which is where the bacteria gets in the bloodstream. It leads to really high fever and then a rash that starts off as petechiae, which are little red dots, that then progress to what are called purpura, which are large bruises. If you ever want to get a pediatrician excited, call them in the middle of the night and tell them your child has purple bruises all over their legs. That's going to cause us to have a panic attack. And the reason for that is we get them into the hospital, and even with our best medical treatment, they still have a mortality rate of 40%. Now, even if you survive meningococcus meningitis or the bacteremia, the problem is that 20% of kids or people that are infected still have long-term consequences, either through blindness, neurological problems, or the loss of limbs. This is something that we commonly see on TV at the beginning of the school years, where it causes this disease and it makes their fingers, toes, arms, or legs turn black, and then they lose those extremities. Now, there's a vaccine that we typically give around the time they're 11 to 12 years old, and then give a booster prior to them going to college about 5 years later. Contraindications are few: having a moderate to severe illness at the time, or having a history of an allergic response to a component of the vaccine with the previous dose. Side effects are usually headache, fatigue, maybe some low-grade fever. As of 2014, a new vaccine called Meningococcus serotype B has been approved. It's not yet in widespread use because we're waiting for insurance companies to start paying for it, but expect it to be part of your child's vaccination schedule in the next coming year or two.